Okay, Dr. Asad, are you ready?
Yes, ma'am.
Okay, let me set the timer for you. I will give you total 10 minutes, and
Okay.
when the 2 minutes are left, then I will prompt you.
Okay.
So your time starts now.
Hello, my name is Asad Khan. I'm one of the medical doctor. Can I confirm your name and age, please?
Yes, doctor, I am Miss Ria, and I am the daughter of Miss Mary.
Okay. Hi, Miss Ria. How are you feeling today?
I'm fine, doctor.
Okay. Is this place comfortable for you?
Yes, yes.
Mhm. Today, uh, mm, we are going to discuss about your mother condition. Will that be okay to you?
Okay, doctor.
Okay. Tell me, what do you know about your mother health, why she was admitted and what was the diagnosis? Do you know anything about it?
Yes, doctor. Actually, my mother came with headache last night, and your staff
Okay.
gave her some treatment and certain tests. But I am very annoyed at this moment because today I have spent much time searching for my mother in your hospital, and no one guided me properly. And I think that something is going wrong with my mother because your staff
Mhm.
nurse just told me that she has been urgently referred to the medical ward because of some reasons. So I just
Okay,
want to know exactly that what's going on.
okay. So, okay. You know that your mother came to the hospital with a headache, and the headache was on the one side. We sent some blood tests, and we started her on treatment. Is that okay to you? You know?
Yes, doctor. Yes, doctor.
Yeah. Actually, when she came to the hospital, uh, we as a team we were thinking of a disease called giant cell arteritis, and in that particular disease, the patient feels severe pain on one side of the head, and it is secondary to uh, uh, some autoimmune disease. That is, the body itself producing the some elements or antibodies against the vessels or against the blood vessels, which causes this kind of reaction or the symptoms. Are you with me?
Yes, doctor.
Yeah. And the best treatment for it, we need to give steroids, and the steroid would help to lower this inflammation, this damage to the blood vessel. That is really important. And the side effect of this steroid is the patient can develop a type of psychiatric symptoms, that the patient would be becoming really agitated, confused. Are you with me? Are you following me?
Yes, doctor. I'm following you. But please tell me that
Mhm.
has my mother developed this side effect?
Unfortunately, yes, she developed these side effects. And because she was agitated and confused, we shifted her to another ward for the further management.
But doctor, why you gave such a bad medicine to my mother?
Hmm. Well, uh, the treatment was according to the guidelines. Like, our suspicion was of giant cell arteritis, and this condition can, if not treated immediately or within few hours, it can develop disability. Like, the patient can lose his or her vision, can develop symptoms of stroke. So that's why we need to treat the patient immediately, and that's what we did. Sorry for that, but she developed the side effects of the steroid.
Hmm.
Are you following me?
Yes, doctor.
And do you have any other questions?
Yes, doctor, I just want to know that since she has developed the side effect, so what you will do now? That will she get better because of this side effect?
Okay. So right now, after the blood reports and the tissue sample results have came back all that it was not showing the sign of this disease, we have stopped the culprit medicine, that is steroids have been stopped. And right now she has been transferred to the another ward, and she has been giving the medicine or the management or in order to calm her down and in order to reduce the side effects of this drug. Any other question?
I can't understand, doctor, that you gave this medicine keeping in mind this diagnosis. So you just gave this medicine just on the suspicion of this disease, and in actual, she is not suffering from it. I am very annoyed. I just want to launch a complaint because your team has made this medical error.
Mhm. Well, I feel really sorry for it, but let me just explain a bit. The treatment which was given to her was according to the locals as well as the international guidelines. Number one. Number two is that she developed the side effects which any patient could develop. Number three, that if you want to launch a complaint against the symptom against this issue, I'm going to support you. I am going to give you the forms as well as the I will give you the contact number of patient liaison service where you can put the complaint that this happened to your mother. Are you following me?
Yes, doctor.
And we are not going to this this whole thing of you getting a complaint will not affect the treatment of your mother. Okay, I'm going to fully support you in your whatever you want to do. Do you have any other concern?
Doctor, when will you discharge my mother? I mean, how much time she needs to stay in the hospital because of this side effect?
Okay, so in it it will be decided by the consultant. We will do the morning rounds. If she was like she was feeling good, she was not agitated or confused, then we can safely discharge her.
2 minutes are
Okay.
left.
Any other questions?
Doctor, is there any chance that I'm afraid that her this mental condition and all confusion that we are talking about will not get reversed?
Uh, Certainly, it won't affect her in the future, but you should keep it in mind that in the future, if any of the doctors were giving the steroid, you should tell them that once she was given a steroid and she developed this side effect. That thing you need to remember. Any other concern?
No concern,
So, uh, just let me summarize the whole case. Mm, uh, you, Miss Ria, daughter of Miss Mary, came to discuss your mother condition that she was admitted last night with a complaint of headache. The team on call treated her as a case of giant cell arthritis because of their suspicion. In the morning, she developed this agitation, confusion, and the blood test and the tissue sample test came back as negative, as normal. So we stopped the medication. We transfer her to another ward for her management of this agitation and confusion. And you, Miss Ria, I'm going to help you in launching the complaint. I'm going to give you the number and contact details of liaison service of our hospital where you can do the complaint against the medical team.
Time is
And
over.
okay.
Okay, Dr. Asad, overall, it is a very good attempt. Just a
Mhm,
few things which I noticed. Do you want
mhm.
me to give you the written feedback or verbal is okay?
Maybe verbal is okay because all the things I have been recording, and I can write it.
Okay, okay, fine. One thing, for example, try to avoid the jargons. Here you tell about vessel, blood vessel. It is a jargon. Use the word blood channel. Okay.
Okay.
And rest of the things, for example, right from the start, we will discuss. Okay, very good. You do the whole pattern, starting pattern, like I told you before as well. Greeting, introduction, checking the identity. One thing again, that try to ask the identity yourself. That are you Miss Ria, daughter of Miss Mary, 65 years old?
Mhm.
Okay, because some
Okay.
surrogates are not that much trained, they don't know how to answer this thing now. So you outside, you know that I have to talk to Miss Ria, who is the daughter of Miss Mary, 65 years old. So your first sentence when you are checking the identity is, are you Miss Ria, daughter of Miss Mary, 65 years old? She will say yes, nice to meet you. Okay. So, first sentence, I hope I have not kept you waiting for too long before you see me, or I hope you are comfortable. Yes, comfortable. So, we are here today to discuss regarding your mother's health condition. Is that okay with you? Yes, doctor. Okay. Okay, one thing here, because here the mother has psychosis. She has no competency at this moment. So we will not say anything like this that we have taken permission of your mother already before speaking to you. Because in this case,
Mhm.
mother is not competent. You don't need to say something like this. Okay. So just that thing that is enough, that we are here today to discuss regarding your mother's health condition. And before we start, just tell me in your own words that what do you know about your mother's health condition so far? Okay, whatever she will tell you, listen it quite carefully. And meanwhile, during your communication, just your posture, your whole body language should be that you are quite attentive towards the surrogate, towards the relative, and keep on nodding the head. For example, just like a real life scenario. Okay. And here, since the daughter is quite annoyed because she has assumed herself that there is something wrong and she has not find her mother in the same ward where she left her the last night. So here you will start. Okay, I appreciate your knowledge regarding your health condition, your mother's health condition, and I am so sorry that you are feeling like this. Try to show some empathy over here and acknowledge that whatever she know. Uh, Regarding that, and acknowledge that she should be informed that her mother has been shifted to another ward. After that,
Mhm.
yes, you explain the events quite clearly since her admission regarding the headache that she has suffered from. Severe headache, especially it was on one side of her head last night. And because of the nature of the headache, the duty doctor suspected that it might be a case of giant cell arthritis. Give a bit pause, I mean,
Mhm.
1 2 second pause, and then you will try to explain that please don't bother with the medical term. I will explain it to you in simple terms. It is a
Mhm.
condition, okay, you tell about the autoimmune thing or something like that. You can simply say that it is a condition, for example, which can happen due to soreness of a blood channel in the brain, because it is inflammation of the temporal artery. No? So you will just
Yeah.
say that it is the soreness of the blood channel in the brain. And in case if this condition is not treated immediately, it can lead to permanent loss of vision. So
Okay.
give some pauses. Although your communication was ideal, just a bit more improvement to be on the um, more
Focus.
perfect side. So according to local and international guidelines, our treating team didn't wait for the test results. And since this condition is a medical emergency because it can cause permanent damage to the eyes, so we started your mother on steroids. Again, pause,
Okay.
because it is a rule that we start steroids if we suspect this condition. So that's why
Okay.
the steroids were started at high dose. to your mother, and it was actually in the best interest of your mother, and it is according to our local and international guidelines. Here now you will try to do more. For example, here you will, before uh, jumping towards that, the patient asks yourself that okay, she will assume that okay, this is actual diagnosis. So here you, right now here you will tell them that it was not the case of giant cell arteritis, because the surrogate can behave like some more aggressive way, no? So here you will tell
Okay.
that the good news is that your mother's headache has resolved, but the lab reports showed that she does not have this condition which we suspected. And now, what has happened, unfortunately, in your mother's case, that she has suffered from the side effect of this medication, steroids, which is called as psychosis. And
Okay.
unfortunately, I'm so sorry that your mother has undergone this side effect, although it is not a common side effect. But what happened is that she has suffered from it, and I apologize to you on the behalf of my whole medical treating team. Okay.
Okay.
So before moving toward explaining the steroid-induced psychosis, uh, and I mean, once you have explained the steroid-induced psychosis, and then you are telling to the patient or the surrogate that don't have giant cell arteritis, she can be more aggressive. So before going towards your steroid-induced psychosis topic, first you have to explain that she is not suffering from this vasculitis, no? And then you
Okay.
will give pauses, keep on checking understanding, keep on asking concerns, and manage those concerns timely. As you did, you perform very well. Just this thing I want to tell you.
Okay.
And then she will ask, okay, what is this psychosis? Or even you can explain it yourself that this psychosis is actually a side effect of the medication steroid, although it is a rare side effect. But what happened is that in this condition, sometimes the patient gets quite irritated, and there are some behavioral issues. Sometimes even they don't recognize the known people, and they are not aware of their surroundings, time, place, and person. But let me assure you one thing, that we will provide all the possible support and treatment to your mother. And she is our topmost priority at the moment. And we have already stopped the causative culprit medicine, and we are keeping her under close observation. That is, at one point, you are telling that this has happened. At the next point, you are telling that we will provide all the possible support, and we can see that it is a very difficult time for you. So that the surrogate will herself, she will get calm, that you are
Okay.
providing support, na? You are just not telling him all the things that has gone with her mother. You are also providing some empathy.
Okay.
After that, for example, okay, again you will ask the concern, again you will check the understanding or any question. And in case, for example, when she was asking that is this condition reversible, or it might happen that these signs and symptoms will not get reversed. So here you can answer this concern like this, that let me assure you that this condition is usually reversible, because in communication, try to have a diplomatic approach. For example, you can't say anything that I am sure or it is certain that this condition will improve, because in medicine nothing is certain,
Okay.
nothing is 100% guarantee. So you will say that usually this condition is reversible, but it will take
Okay.
some time, and the exact duration of time we are not sure about. For example, when she was asking from you that how long my mother has to stay in the hospital, again, yes, you answer it quite right, that I will we will speak to our consultant and we will get back to you, and time will basically decide. But we are having her in close monitoring, and our treating team is there to provide all the possible support and help to your mother, something like
Mhm.
that.
Okay.
And after that, for example, you will, yes, when she was asking that what will happen now because of this side effect, or yes, you told about that we have already stopped this culprit medicine. Even you can say that we have started her on some soothing medication in order to keep her as much relaxed and as much comfortable as possible. And
Mhm.
basically, there is a whole team of doctor who is providing her the possible best care. All the possible care
Mhm.
that we can provide, we are providing her. And For example, when she was asking from you that why have you given such a bad medicine, yes, you answered that concern well. Some other sentences you can keep whenever there is a side effect of any medicine. For example, you can say that whenever we start any medicine to any patient, we have to weigh the benefits versus risk. And in your
Mhm.
mother's case, the doctor and the treating team thought that it was in her best interest. And that's why this medicine was started in order to save her vegan. And the duty doctor started this medicine in the good intention of your mother. And
Okay.
okay, one thing that will be exaggerated, that for example, in case if we suspect a case of giant cell arthritis, or there is such kind of headache that is that this patient has presented, and we do not start the steroid, this is a crime, or this is actually the medical error. Because once there is loss of vegan, there is permanent loss of vegan. Then you can't do anything. If, for example, the patient has presented to you and you have started the IV steroids, patient has presented to you blindness, it is a chance that her vision can come back to normal. But there, it is just a chance. There is no 100% guarantee that it will come back. Na? So this thing, and one thing more, when she was asking from you that I want to launch a complaint, yes, you answered it well, but let me tell you one thing, that this is not a medical error. You will say that okay, I am there to support you, and I will provide you all the proper channel or guidelines that how you can launch the complaint. But this is not a medical error. You have to tell this to the examiner basically. That so that because in UK basis now there is no viva. So basically they will assess you in that 10 minutes. That what they will answer. Okay, some candidates can go towards the launching complaint whole scenario, that how what are the steps of launching the complaint. So you will just say that it's your right to complain, and I will even guide you how to launch the complaint. I will guide you the proper channel, but it is not a medical error. However, if you still want to launch a complaint, you can launch a complaint, but at this moment, our main priority is your mother's health condition. So this
Mhm.
is about that, no? And
Okay.
other thing is that, for example, you will again show some empathy in the form that you will reassure her that your treating team will be in close touch with you, I mean the Miss Ria, so that she gets all the information about all the development, because it was her concern that I was not told anything regarding her shifting and regarding her side effects, whatever has happened. No? And
Okay.
when the examiner prompts you that 2 minutes are left, here, okay, you can summarize, but summarize if you have done all the steps, for example. For example, here social history is important in 2 3 ways. And no need to ask about smoking, alcohol, job, or something like that. Only this thing that, for example, um, I will provide you leaflets, brochures, and website address so that you can get more information regarding the um, giant cell arthritis and regarding the steroid-induced psychosis. And also, is there any support at home? I mean, those questions, social support, social services that you can
Mhm.
offer to them. And even you can tell them that your mother is here in the hospital till she get better. We are in close touch with your mother. And in case if you want to go back home and do your work, whatever, you can go home, because our teaching team and our medical staff, nurses, all are there to support your mother. And in case if you need any convince or that I mean, we can arrange a cab for you.
Okay.
So this thing, and after that you can summarize if your time is still remaining.
Okay.
Okay. Any questions from your side
No.
or from any other? Mm,
No. Thank you